Welcome to this online webinar, Stop Smoking with Smokefree Norfolk. In this webinar, we'll look at the following topics: how Smokefree Norfolk can help you to quit, understanding nicotine addiction, medications to help with cravings, preparing for your quit, and what happens next. Following this information session, Smokefree Norfolk will be there to support you on your journey. You will be asked to complete and return a medication choices form via a link at the end of this webinar. You will then attend your pre-booked one-to-one appointment, and don't forget to bring a list of your medication. Finally, you will have ongoing one-to-one appointments for the entire treatment program. This usually lasts about 12 weeks. Giving up smoking. We all know smoking is harmful to us. It can cause many different health problems, including many cancers, heart disease, and strokes. In pregnant people, smoking can cause miscarriages and stillbirths and cot deaths. Babies in the womb of smokers receive less oxygen and also get all the harmful chemicals passed to them from cigarettes. They develop more slowly and are at more risk of lifelong health problems. Think about the reasons you want to stop smoking and note them down. Your consultant will also ask you this. Consider the benefits, such as more money in your pocket, a healthier lifestyle, or the safety of those close to you. With our support, you're 5 times more likely to quit smoking, so your reasons can become a reality. Now that you are on your journey, let's begin by understanding your addiction. Your journey to quitting will take approximately 12 weeks. The first 4 weeks will be the hardest, with the nicotine craving reducing, but still present. You may find it an uphill struggle, but don't worry, you're not alone. After 4 weeks, the nicotine receptors have halved and the process becomes easier. Around week 8, the cravings should be minimal. However, we continue with you until week 12 to guide you safely past this point. However, remember that just a single puff on a cigarette during this journey will send you right back to the start, so it's important to not smoke at all after your quit day. During your 12-week process, we can offer various medications to make your journey much more comfortable. This includes nicotine replacement, which can be used with or without a vape. Non-nicotine-based medication such as Zyban or Champix. Nicotine replacement is suitable for anyone aged over 12 and is suitable in pregnancy and breastfeeding. Nicotine patches provide nicotine doses for 16 or 24 hours. Apply one when waking and change where on your body you apply each day. We usually suggest patches are used in combination with another nicotine replacement product. We will talk about these next. Nicotine gum can be chewed like regular gum, but should be parked between the cheek and gums to allow it to trickle nicotine into the body through the lining of the mouth. Up to 15 pieces can be used each day and, like most of these products, is best used regularly throughout the day rather than when you have a craving. Nicotine mouth spray is another popular option. This can be used up to 64 times a day and is said to relieve cravings in just 60 seconds. Spray onto the inside of the cheek or apply to the gum with a clean finger. A nicotine inhalator is a small device that contains nicotine cartridges. This can be puffed on like a cigarette. It is usually more comfortable if you just puff into your mouth, as this is where the nicotine is absorbed. It works best if the cartridges are kept warm, and a full strip of cartridges can be used each day. Each cartridge lasts around 40 minutes of puffing time. Lozenges can be dissolved in the mouth, like a boiled sweet. You can take 15 per day. Avoid the temptation to crunch or swallow them whole. Park them between the cheek and gum to allow the nicotine to trickle into the system through the lining of the mouth. Whatever product you choose alongside your patch, it is often a good idea to practice with it for a few days before you get to your quit day, so you get used to the taste and using it. You might wonder why nicotine is given for addiction. Cigarettes deliver nicotine to the brain very quickly, However, products like the ones we have just described deliver nicotine much more slowly. Anything to the left of the red line will allow the time for nicotine receptors to down-regulate and curb your addiction. Cigarettes, vapes and e-cigarettes containing nicotine will continue the addiction. So let's take a quick look at vapes and e-cigarettes. Research suggests vaping is significantly less harmful than smoking. They do not contain any harmful carbon monoxide or tar, and research suggests there is no harm to those around you if used indoors. However, using a vape will keep you addicted to nicotine longer compared to the products we talked about previously. If you purchase your own vape, visit a reputable vape shop and ask for their advice. Preparing for your quit. Now you are ready to quit, there are additional steps that can help you on your journey. If you make changes to your smoking habits before you quit, it increases your chance of success. Firstly, you may find it helpful to talk to those around you, especially if they smoke, so you can work out how they can support you, even if they are not choosing to quit. Think about your smoking triggers, routine, stress, and boredom. Consider how you will cope with these when you are not smoking. You can discuss your concerns with your consultant, and they will talk through possible coping strategies. Also think about your quit date. Make sure it is right for you and realistic. Your consultant will discuss this with you. You will also need to introduce some habitual and routine changes to help you quit. If you smoke inside, start smoking outdoors. This protects your loved ones and pets from secondhand smoke, and you become used to being in your home without a cigarette. Separate your cigarettes from your usual triggers, such as cups of tea or coffee. Start having one before the other. Change other routines you might have, such as washing up after a meal, rather than rushing to have a cigarette. Finally, it is also a good idea to get rid of all your cigarettes, tobacco, lighters and ashtrays before you quit, so you can avoid temptation to smoke. By the time you reach your quit date, you will have practiced new routines, and this often makes quitting easier. Stress and boredom. Stress is one of the biggest triggers for smoking. You may need more of your nicotine replacement products when you are stressed, so make sure you always keep them handy. It is important we remind ourselves that smoking does not alleviate stress. In fact, smoking causes stress when our nicotine levels drop. So, the relief a cigarette brings is only a reduction in the stress the cigarette caused in the first place. To avoid stress smoking, you might want to talk to someone about what is making you feel stressed, or consider mindfulness techniques or new hobbies. If the stress is ongoing, you may want to get support from organisations such as the Wellbeing Service or Mind. What next? Now that we have explored and understood nicotine addiction, the medication options and methods for helping you quit, what's next? Step 1 is to click on the link and return your medication choices to use before your appointment. You should choose 2 forms of nicotine replacement, or vaping, or Champix, or Zyban. We are not able to combine nicotine products or vapes containing nicotine with Champix or Zyban. Step 2. Consider the date you want to quit and be ready to discuss this with your consultant. And finally, Step 3. Attend your appointment with your stop smoking consultant. You will be asked for details of medication you are taking and questions about your health. The consultant will arrange medication through your pharmacy or GP and answer any final questions you may have.